The Alabama-Honduras Medical Educational Network is a faith-based NGO representing a confederation of 10 to 12 North Alabama churches. The AHMEN organization is an outgrowth of the aftermath of Hurricane Mitch. During a 3-day period in October of 1998, Mitch devastated the Central American countries of Honduras, Guatemala, and Nicaragua, resulting in 11,000 known dead and an additional 11,000 missing. Since its inception, AHMEN has sent humanitarian aid brigades to work in the remote regions of the northern coast, the Bay Islands, and the Central Highlands of Honduras. You might recall from your elementary school geography that Honduras is one of 5 nations that were often referred to as the Banana Republics. This name was coined by the American writer O. Henry in reference to the powerful political influence held by various fruit export companies. Generally mountainous, the country is marked by fertile plateaus, river valleys, and narrow coastal plains. It is located approximately 1,000 miles due south of the state of Alabama. Honduras is the approximate size of the state of Tennessee. AHMEN's aid brigades vary considerably in their composition. Some have veterinary components, some have major construction elements, some conduct training seminars. Most all AHMEN teams have medical capabilities. An increasing number offer extended eye and vision care. Regardless of its composition, the medical educational mission of our teams is secondary. Our primary purpose is to demonstrate the love of Jesus Christ and to bring His Word to the disenfranchised and marginalized indigenous people of the second poorest nation in our hemisphere. The countryside is a curious mix of mountains, jungle, rolling hills, and seashore. Honduras has many wonderful and wild rivers. The jungle is beautiful and it is everywhere. Exotic fruit hangs from nearly every tree. Walking around Honduras is like being in a giant tropical greenhouse. Everywhere you look, there are blooms and color. Much of AHMEN's coverage area lacks even the most basic amenities. Travel is very limited, and many live in isolated villages. Most of rural Honduras functions as a self-sustained economy. If you want to eat it, you catch it or you grow it. Honduras is the second poorest country in the Western Hemisphere. Better than 1/2 of the population is below the poverty level, living on less than $1 a day. Most of the arable land is owned by a very few wealthy landowners and a few multinational corporations. Mud, thatch, and corrugated metal are among building materials throughout rural Honduras. Many of the people living within AHMEN's area of coverage have limited or no access to education, have never seen a doctor or dentist, and have none of the protections of the law. Corruption is the rule within the government. Honduras has been designated by the UN as the world's most deadly place, with the highest number of murders per capita. Most AHMEN teams are structured around a medical component. Besides doctors and nurses, our medical teams may include pharmacy, lab, veterinary, dental, and vision services. Eye care is another major aspect of many medical brigades. Eye teams screen for eye diseases such as cataracts, glaucoma, and macular degeneration, among other things. They measure visual acuity, near vision and far vision, and fit eyeglasses, readers, and donated prescription glasses. They also distribute sunglasses, eye medication, eye health information, and Christian literature. Teams focusing on education conduct instructional seminars and maintain several vocational schools, libraries, and reading rooms. In addition, AHMEN is in partnership with Servants in Faith and Technology, known as CFAT, to provide leadership training within 3 geographic regions of Honduras. AHMEN's traditional activities in education focus on vocational training to develop marketable skills. One of AHMEN's longest-standing efforts has been its sewing schools. Note that the clothing pattern is simply drawn on the chalkboard, and the students then adjust it to the size wanted and sew the garment. Note also that all the initial training is done on treadle machines. This is in part due to the lack of electricity, but is primarily due to the fact that the students learn better with a slower speed machine. AHMEN teams engage in numerous other activities and projects. They plan and complete construction projects, build churches, renovate dormitories, construct feeding kitchens, and install water filtration systems. AHMEN operates several nutrition programs where poor children are guaranteed at least one healthy meal a day. Shalom is a dormitory for at-risk girls in the compound of La Cruzadas Church in the city of La Ceiba. This facility affords up to 20 girls a place to live and go to school. All these girls are sponsored by AHMEN members. In response to natural emergencies, AHMEN acquires and transports critical supplies such as food, clothing, and shoes to Honduras. One of the most often requested items in AHMEN clinics are Bibles and instructional reading materials on issues confronting teens and young adults. In response to this request, AHMEN has partnered with several publication houses to provide Bibles, tracts, and age-specific materials. AHMEN also publishes and distributes literature on such topics as public health concerns, parasites, malaria, and HIV. AHMEN teams also distribute literature on how to care for one's eyes. In addition, through special arrangements with the publisher Biblica, AHMEN produces scriptures in large print for low-vision adults. All these publications are in Spanish, with the original works edited for language nuances unique to Honduras. One of the unique features of advanced medical brigades is that they often discover persons in need of extremely specialized care that exceeds the capabilities of our mobile teams. AHMEN has developed an extensive referral network to assist complex and special needs patients. AHMEN is on the verge of a new era in eye care. We have recently purchased a surplus surgical ophthalmic microscope and moved it to Hospital Loma de Luz at Belfonte on the rural north coast. We hope to soon have a permanent facility for eye surgeries and host surgical teams throughout the year. All of AHMEN's humanitarian activities are secondary to that of evangelizing. Often this occurs within prayer teams that meet and pray with patients who attend a medical clinic, or it may be during a church service or Bible school that is conducted by a team. It is as likely, however, to come through the simple demonstration of our love for the people and country. AHMEN teams are the hands and feet of the one who calls them to this distant land. Extended eye care is a component of many of the AHMEN medical brigades. Human vision is complex, and correcting for even the simplest abnormality involves substantial resources. First, there are a host of external problems that affect eyesight in Honduras. Cataracts and pterygiums are quite common. In addition to the extreme ultraviolet rays of the sun, eye problems are exacerbated by blowing sand, dust, and unvented wood-burning cook stoves. The first stage in an AHMEN eye clinic begins with an examination of the eyes for cataracts, pterygia, and abnormal pupils. Ocular muscle coordination is evaluated, and the patient is screened for glaucoma and macular degeneration. Next, the patient's far and near visual acuities are measured. A variety of charts are used to account for differing levels of literacy. If a patient's far vision acuity is worse than 20/30, a handheld autorefractor, typically a Retinamax 3, is used to determine the prescription required to correct the patient's far vision. Our protocols dictate that each patient is refracted twice for accuracy. Sometimes patients' eyes are dilated for a more accurate examination. For each patient, the task becomes one of finding a best fit pair of glasses in the inventory of donated used eyeglasses. The computer generates a pick list of the top 3 or 4 best fit glasses in our inventory. Developed by Kendall Optometry Ministries in Knoxville, Kentucky, the central components of the system are the Retinamax, a computer, and the inventory of used eyeglasses. Each AHMEN eye care team carries an inventory of almost 4,000 pairs of prescription and reading glasses. AHMEN's inventory of prescription glasses comes exclusively through donations. In the past, some of these donations have come from organizations such as the Lions Club or Direct Relief International. Today, 100% of AHMEN's prescription glasses are donated by private individuals, school groups, and civic or church organizations. AHMEN must collect and process at least 2 pair of glasses for every one usable. Each pair of glasses is carefully checked for cracks and scratches and then cleaned and sorted by prescription and type of glasses, using a lens meter which sends these parameters to the computer, and they are ready to be entered into the computerized inventory. The stock of donated readers and sunglasses generally has to be bolstered with additional glasses that are purchased through wholesale vendors. The average cost of each pair is around 75 cents, but they are hard to find. In normal years, the eye care team must collect and process around 1,000 pairs of prescription glasses to replenish those used in the clinics. This year, the goal is to double our existing inventory of prescription glasses. In addition, we will need around 500 pairs of reading glasses and 1,000 pairs of sunglasses. The substantial need for glasses means that we will need assistance in collecting new and used eyeglasses from individuals as well as churches, schools, and civic groups. A sponsoring group would be responsible for promoting a collection drive and placing one or more collection boxes. At the end of a 4 to 6 week drive, contact AHMEN to arrange pickup of the glasses. A continuing drive would be wonderful. Not everyone will have glasses that they can donate, but they may still want to help. Suggest that they stop by several of the cheap dollar stores and purchase inexpensive reading glasses. We are always in desperate need of readers of 1.00 diopter and any reader of 3.00 diopters or above. Or, it is always helpful to have someone send money to AHMEN and designate it for the eye care ministry. Our heartfelt thanks to you for your consideration of this opportunity to help show God's love.